Welcome back. With South Africa's COVID-19 vaccination program beginning to pick up pace, drive-through facilities are among the new vaccination sites being set up. One such a site is at Zwartkops Raceway in Centurion. Anti-crime activist and site spokesperson Yusuf Abramjee joins us now this evening to tell us more about this site. Yusuf, always a pleasure being in conversation with you. Talk to us about this Zwartkops Raceway. It's certainly been doing the rounds on social media, and we've been able to track just how many people have come in to get their jabs. How is it faring, in your opinion?
Good evening, Faith. We've been operating for just over 2 weeks. The Gauteng Premier, when I met him at the Muslim Association of South Africa's drive-thru site in Gauteng, said to us, why don't we start the capital's first drive-thru site in the Pretoria on the Shwane area. I took up the challenge and I mobilized members of the community. And on the Friday, just 2 weeks ago, the Premier came and we officially opened the first drive-thru site at the Zwartkops Raceway on the R55 in Centurion. Within 10 days, we were able to hit the 5,000 vaccination mark, which we believe is a great achievement in such a short period of time. And we hope that by this week, Tuesday or Wednesday, Faith, we should be reaching the 10,000 mark. Just to give you an idea, when the registrations opened for the over 18s, we had a queue of 3 or 4 kilometers. This morning, as early as 7 o'clock, the R55 road, the busy road between Pretoria West and the Centurion area was lined up with about 2 or 3 kilometers of cars, people waiting patiently. We had to extend the number of vaccination bays, and we're offering both the Johnson & Johnson and Pfizer vaccines. The response has been fantastic, and while people wait in the queues, they are very patient. We provide a very friendly service, a very user-friendly service, quick, efficient, and you get a jab in the comfort of your car.
Yeah, do you think that that is the way that we're going to see an uptake in the number of people getting the jab, Yusuf? That people are more after the convenience of getting a jab as opposed to perhaps the amount of time it would take to get yourself vaccinated? That knowing that I'm in my car, you know, it's like going through a drive-through eating, place, an eating joint. You don't have to worry so much and stress so much about the logistics involved in getting a jab. Could that possibly be the solution for us to actually see an even bigger uptake?
Most certainly, we've seen that, for example, at the Gauteng site and some of the other drive-thru sites, people are happy to wait in the comfort of the vehicle and get the jab. Now, when we look at the world experience, especially in the United States of America, that has become a very famous point where people are getting their vaccines, Faith. And I believe that even in South Africa, people are happy to sit in their cars, listen to the radio, do their work, and even for 2 or 3 hours, just get through the drive-thru and make sure that they get a jab without going out in the cold or in the heat, without sitting and waiting in long queues. There's no problem with social distancing. And it seems to be a working formula. And I hope that government will expand the number of drive-thru sites they have in other parts of South Africa. We know in KwaZulu-Natal, specifically the Durban area, the Muslim community has started a similar site. And I think the recipe is one of success. So the formula is one of which is working. We know that in many parts of the world, there's a lot of incentive for people to vaccinate. In fact, in America, they're even having a lottery system where they have a lucky draw where you can win a few $1,000s. Well, we don't have that kind of resources. But what we do offer, which I believe has been a draw card, for example, this morning, the first 100 people that went through the vaccination base, they get a pastry. They get a bottle of water, a vitamin C sachet. We give them a sanitizer. So this seems to be a draw card as well. We are obviously trying to get people vaccinated. Yeah. And I think it's an important way to get people to get the jab.
Yeah. Yusuf, do you ever find that some of the people that you encounter are still very vaccine hesitant? And how is it that you start these conversations around the safety of vaccines as well as the process of vaccinating? There were many calls from time to time actually saying what we need is more transparency and we need more appropriate and adequate information dissemination so that I can make an informed decision when I get the jab.
You know, it's a very interesting question. Most certainly we are seeing more and more people who are anti-vaxxers now coming forward. We know that in certain communities, people are totally against the vaccines, but I think the mindset is now changing. We're even seeing that more males are coming through. We know, Faith, there was a suggestion that more females are getting vaccinated, but we're now seeing a good mix of male and female. We are seeing a massive uptake in people over the age of 18, although the last few days we've seen a lot of elderly people over the age of 60 also coming to get their jab. So most certainly there's a mind change. The other day I had somebody who was very outspoken against vaccines. He came to get a jab and I asked him what made you change your mind. And he said that the misinformation that he's seen on social media especially kept him away, but he's now convinced that the vaccines are the way to go. Maybe let me also quickly add, Faith, this particular drive-through is a partnership between the Gauteng government and the community. We have volunteer doctors, volunteer nurses, volunteer paramedics, volunteer members of the community who are doing admin data capturing. And this would have not have been possible without the volunteerism, which is active citizenry at work. But the great news is more and more people are getting their jabs, and we appeal to them, come and get your jabs. And really, we believe it's a way of saving lives, Faith.
Yeah, well, Yusuf, I mean, you're speaking here about active citizenry. I mean, even if we have to look at Limpopo as a case, for example, Limpopo Health MEC, of course, Pope Ramatuba, saying that the way that they managed to get so many people vaccinated in the Limpopo province was that they somehow democratized the process of vaccination. They did not make it just a government initiative. They gave a lot of the initiative to the community members so that the communities could be the ones that call on other members of the community to get themselves jabbed. Is that the way that we're going to win this when it comes to getting people vaccinated? That we don't find government holding on to information and hoarding the championing of this vaccination drive, that the more you disseminate it to members of the community, maybe people can identify with their community members as opposed to maybe a government official?
It's such an interesting question, Faith, and I think you're absolutely right. The Limpopo formula is a winning formula. And I think what the Gauteng government has now done through the Premier and through the MEC for Health is to try to get more community partnerships. We're seeing more pop-up sites becoming available. We even, for example, seen the Gauteng government coming to radio and TV stations trying to urge them to get vaccinated, taking the private sector along. We as civil society have to take the lead. If we as civil society and members of the community can show that vaccines work, I think it will go a long way in influencing, especially those people who are against the vaccines, to come forward. So I think the Limpopo one is a good example. And really, I think we have a lot of work to do. We know the numbers in Gauteng are not as much as high as other provinces. Limpopo is leading the way. We know that Gauteng is densely populated. But I think the uptake, the numbers of increasing numbers we are seeing, for example, yesterday, I think Gauteng hit about 75,000. The target is 100,000. We still have got a long way to go. But if civil society, communities, religious bodies, everyone can work together and take ownership, I think it will help a hell of a lot, Faith.
Yusuf Abramjee, always a pleasure. Thank you so much for joining us this evening. Anti-crime activist there, giving us the latest on the vaccination drive that is currently underway at the Zwartkops Raceway.